Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery. So today I welcome you to the fourth lecture in the series Ultrasonography. I know videos are getting little bit late because lot of work pressure. Now I married, so kind of family pressure is also there. So balancing the work as well as life and along with this passion is a little bit difficult, but I will go on. Whenever I will get time, I will make videos. So let us forget that. So I welcome you to the fourth lecture in the series Ultrasonography. As promised, I will be discussing regarding the elastography. Okay, elastography, you may not find the book which I am referring. In that book it is not mentioned, and elastography is kind of new to the veterinary science. Okay, it is well researched in human science, or you can say medical science, but it is not that popular or not that explored in veterinary science. So I am giving you this information. You can, if you are very much interested in veterinary diagnostics now, which comes under veterinary surgery and radiology, so you can work on this particular topic. I have worked in this particular topic, so I know this has good potential in diagnosing many diseases. So you can work on this particular topic, that is the elastography. Okay, let us go to the lecture. So this is elastography. And before going to the video, some formalities. Okay, please, if you are liking my content, if you really appreciating my efforts, please do share among your friends, juniors, colleagues or seniors, all of them, and do follow me in the Facebook. In Facebook I post, I'm not that regular in Facebook, but I do post different cases which I get in the field. There are surgical procedures, all those things I post in the Facebook. Important one is the Instagram. Obviously I post the notes as well as the update regarding the videos. Okay, and remember, no need to take any notes. I will provide the notes in the description. You will get a drive link from where you can download the notes, as well as this PPT in PDF format will also be provided. Simply listen. Okay, so today I will be mostly referring to my research. Okay, I have done some research on elastography, and also I have followed different research articles. The references will be given at the in the end of the slide. Okay, so let us go to our topic, that is the elastography. So basically, before going to the elastography, you should know that a tissue is made up of tissue, or you can cell, group of cell is tissue. Tissue is made up of like protein, fat, water, like this. In protein, most important one for elastography point of view is collagen and elastin. So all these things are present in a tissue. Okay, so when they are present in a tissue, they have certain elasticity. When it is combined, it has a certain elasticity. Now let us assume that that tissue has undergone some change. Why? Because there is inflammation. Suppose there is inflammation. Suppose there is fibrosis also. Fibrosis, it may go fibrosis, or it may go cirrhosis, like fat depositions, or it can have the cancer, that is neoplasm. Neoplasm is the appropriate term. Cancer when malignant. So all these things, when it will go change, inflammation, these characteristics will change. The protein will change, the fat will change, the water will change. Suppose there is fibrosis, some degree will change. So when these things happen, whether inflammation or fibrosis or fat deposit or neoplasm, when these things will be there, this elasticity value will change. This elasticity value will change, or the elasticity will change. Suppose here the elasticity is A. Now it will not be A, it will be B. It will change. Okay, so what will happen if we have any diagnostic that can measure this particular elasticity change? Then we can diagnose that this tissue has undergone some problem. Regarding the application, but suppose you know that in inflammation the elasticity is C, in fibrosis it is D, in fat deposition it is E, and in neoplasm it is F. Suppose you measure that particular tissue and you find the elasticity value to be D, then you can tell that that particular tissue has gone fibrosis. Suppose you find a case where the elasticity value is F, then you can tell that, or you can diagnose that that particular tissue has some neoplasm. Okay, that is the importance of elastography. Okay, so what happens in elastography? Slightly physics, you don't need to worry, don't need to remember also, so just physics. So it basically measures elasticity. In technical terms or in many articles you will find it measures the stiffness. It measures the stiffness. Okay, so it basically measures Young's modulus. Young's modulus. Young's modulus. The formula for Young's modulus is stress by strain. Stress by strain. Stress is basically the force applied per unit area. So how will you measure elasticity? You have to apply some force. Suppose there is a tissue, you are applying the force. When it is normal, it will deform different. When it is abnormal or some change, it will deform different. Okay, on that. So how much force you have applied per area? Strain is change in dimensions. Change in dimension, length or breadth. Okay, change in dimensions. This much you have to remember. If you are much into physics person, you can refer those articles. Will I give the reference in the last slide? Otherwise, simply remember this one. It basically measures the Young's modulus, that is the stress by strain, that is force per unit area divided by the change in the dimension. Okay, the unit is basically expressed in kilopascal or meter per second. These are the units. From machine to machine it varies. In some machine it may be expressed in kilopascal, in some it is meter per second. Okay, know your machine, which machine you have. Okay, now let us see here. This is a soft tissue and this is a hard tissue. When the compression is applied, this is compression. When the compression is applied, soft tissue being soft will get deformed. This is deformed. But when a tissue has undergone some change and it has become hard, it will not deform. Not deformable. So in research, the qualitative parameter for elastography is deformability. Deformability. Whether you can deform that, whether the tissue is particularly can be deformable or not. Okay, deformed simply means the change in morphology. Deformed. Okay, so you have understood some basics regarding the elastography. It simply measures the elasticity or stiffness. Okay, so when you will be applying the compression force can be applied through the transducer. It is applied through transducer. It can be of two types. One is manual compression, manual compression. Another one is RF. RF simply means acoustic radiation force impulse. Okay, simply means it will in manual the operator. Suppose I am operating, this operator will put force by hand, by his or her hand. He or she will put force. That is manual compression. In RP, this machine itself will generate that compression. So whenever there will be compression, suppose this is the tissue which is you are interested for measuring the elasticity or stiffness. Whenever there will be compression, there are two types waves that will be generated. One along the line, because you are compressing in this particular line. So this wave or this particular wave is known as compression wave. I think it is written here. Yes, this is compression wave. So it is generated along the direction of the sound beam. Okay, now when it will hit particular structure, there will be another wave which will be generated perpendicular this particular compression wave. You can see here, this is another wave. Simply in a pond or in a lake, if you will throw a stone, one stone when it will hit, there will be a wave directly below that particular point of interaction, that is the compression wave. Another wave which spreads from that point towards the periphery, that is the shear wave. That is the shear wave. Shear wave. These two waves are very important. Most important is the shear wave. This one is the very important. Most of the advanced elastography machines have the measurement, or it measures the data of shear wave rather than the compression wave. Okay. So these two waves are generated. Compression waves travel in the form of compression and rarefaction, just like sound wave. But these shear waves, they travel in the form of a like sine wave. Okay, like this. So these two waves basically generated. Important one was the shear wave. Shear wave. Most of the advanced elastography machines have this shear wave measurement. Now coming to the classification of the elastography. This is basic classification. Okay, it is not, you may not find in many books, basic classification. So this elastography can be of two types. First one is the strain imaging, another one is shear wave imaging. In strain imaging, mostly the compression wave data is measured. Compression wave data. Compression wave, mostly through compression, manual compression. We'll discuss one by one, no need to worry. In shear wave, as the name suggests, it mostly analyzes the shear wave. Okay. In strain imaging, there are two types. One is strain elastography, another is acoustic radiation force strain elastography. But it is not that commonly used, not that commonly available also, but it is there. In some machines, you may find this acoustic radiation force strain elastography. Under shear wave imaging, there are three. One is transient elastography. It is also known as 1D elastography, point shear wave elastography or PSWE, and that is next is 2D shear wave elastography, 2D SWE. This is 1D PSWE, 2D SWE. Another one is, recent one is the supersonic shear wave elastography. Okay, not that research has been conducted over for the supersonic shear wave elastography. It is very new and most advanced one, but in practically or in different articles you may find strain elastography, transient elastography, point shear wave elastography, and the 2D shear wave elastography. Okay. Next, we'll go one by one. First one is the strain elastography. In case of strain elastography, you have to use manual compression. My wife is disturbing. Manual compression. So the manual compression simply means you have to use the transducer for the compression of that particular tissue, the area of interest. Manual compression, due to this particular phenomena, manual compression, it is mostly operator dependent. It means if a operator is very experienced, he can compress or he can get accurate data. If it is he or she is not that inexperienced, then he may not get accurate data. It is available with the conventional USG. We may find a specific probe, or it is mainly commonly available with the linear probes. Or if a machine has some microconvex, most commonly linear, which I was doing the research, it was available with the linear probe. Okay, simply it means it is available with the conventional USG. We don't need a special instrument or special probe for this particular elastography. Now you will find the elastogram data as well as E value. We'll see the images and also the what is E value. No need to worry. The disadvantages are being you cannot select multiple areas. Suppose this is the tumor area which you have scanned. You have to select a single area. You can increase the diameter, but you cannot select multiple areas. Okay, when you will select multiple areas, the data is more accurate. When you are selecting a single area, it is not that accurate. And it is obviously inconsistent. I told you it is mostly operator dependent. If he or she is experienced, then he can get a good result. If he is inexperienced, then he or she may not get good results. Let us see some images of this particular elastography. Here you can see this is the structure, this is the tissue. Okay, here are some structures. So here the operator has to manually compress. So you can see that this is deformed now. Okay, depending on that particular tissue characteristics, protein, fat and water, it will get deformed and the value will be displayed. Now let us see some image. This is from my research. You can see here this is actually a tumor. Okay, you can see this blue, green and red, this is known as elastogram. This image is known as elastogram. Okay, now the blue being the hard and the red being the soft. Okay, this particular bar can be inversed depending on the machine. So you may say that always blue is hard. It does not work like that. If it is inversed, then this particular red can be hard. Okay, so depending on your machine, most commonly it is blue means hard and red means the soft and the green is intermediate. Like this is the B mode image. This is B mode image. Over this B mode image, the elastogram will be displayed. This is elastogram. Okay. By this you can see the areas of hard and soft tissue. Okay. Let us see another image. This is another image. You can see this is B mode image and this is the elastogram. These are hard tissues, these are soft, this is green is intermediate. Okay, another image. See here, this is a nice case of oral tumor actually. You can see this tumor mass and you can see that entire tumor is mostly hard. Okay, blue coloration, this is blue coloration, this is elastogram. It can suggest you that whether that tissue is particular has undergone any change. Hard means simply change. Most of the tissues are soft except for bone or tendons, they are comparatively slightly hard, but other soft tissues are mostly soft. Now you see here, this is the B mode image, this is the elastogram and you will mostly get E value. You see here E value. Okay, in case of strain elastography. Okay, so that particular oral tumor case, this is B mode elastogram and E value. This is also same E value, and here there is it was a case of lipoma actually. So you can see here, this is the elastogram, and see you can increase the size of point, you can increase the size of area of interest, but you cannot select multiple areas. Okay. Next is the transient elastography. Transient elastography, also known as 1D elastography. 1D elastography. 1D elastography. So it is very fast and easy to use comparatively compared to the every other elastography. Very fast and easy to use. It is used a principle known as mechanical vibration. Simply the probe will have a vibrator. It needs special instrument. This is the disadvantage of this one actually. It needs a special machine, special probe. It is not available with the conventional USG. So also the disadvantage will be you cannot measure all the B mode or Doppler or other things. Okay, so you have to simply measure only the elastography. You cannot measure all those conventional USG things which are available. Now it also you have to take multiple readings. Research suggests that minimum 10 readings to get accurate data. Minimum 10 readings. Okay, this can be a disadvantage. Another thing, it is not that common in veterinary use. I did not find any kind of article regarding the use of 1D elastography in veterinary science. Mostly it is used in human science for the assessment of liver. Okay, liver fibrosis for the assessment. It is commonly used. So this is basically the elastography, the 1D elastography. Vs the velocity, CRO velocity, E is the elastography. You can see the measurement is kilopascal here. So you have to take multiple readings. Okay. This is another image. You can see this particular machine in the brand name, I think FibroScan. So this you have to require a special probe, special machine. This is the disadvantage, but it is very fast compared to the other elastography machines. Okay, by this you can see here the value is coming and the unit is kilopascal. Next is the point CROF elastography. Point CROF elastography. It works on the principle of RP. It means the operator doesn't have to manually compress that particular tissue of interest. The machine will do. Okay, and it is available with conventional USG. So you can get all the B mode or M mode or Doppler data also along with the elastography data. You can, for correlation, all those things are necessary, and also for B mode you have to measure what is the size of nodule. All those things can be used. Next, the disadvantages are you cannot select multiple area. You have to select particular single point. Point CRO, single point can be selected, and you will not get elastogram data. that is the blue and coloration data, those data you will not find. Let us see some images. Here you can see, okay, you see this CO wave traveling, this CO wave, this is the sound wave, this is the region of interest is here, the sound wave is traveling nearer to that particular area and the CO wave is generated, and this CO wave is basically measured, because the 1D elastography, point CO wave elastography and 2D CO wave elastography, they measure the CO wave data. Okay, you see here, this is the region of interest. You can select one point in particular structure. Suppose this is the structure, you have to select one point and you will get your value. Let us see another image. See, this is the image. This is a testis actually. So the testicular area, you can see, you can select a particular area, particular point, then you will get all those data. Okay, average meter per second. Here it is evaluated in meter per second. It can be meter per second, it can be kilopascal, it can be interconvertible. Okay, next one is the 2D, that is 2D CO wave elastography, the last one. So it is based on the RF, okay, acoustic radiation force impulse elastography. It is available with conventional USG, of course. Multiple area can be selected. Okay, this is the most advanced one that has some research in veterinary science. Okay, multiple area can be selected. Elastogram data available as well as shear wave traveling data is also available. Shear wave data, we'll see the images, don't worry. It is the currently most advanced and most accurate one. Okay, let's see some images, then you will see here. Okay, this is the elastography data. This blue coloration is basically the elastogram. Can you see the wave data? This is the shear wave data. You can see this shear wave data. Okay, both data can be available and you have to select. You can select multiple things, but remember, always select, while selecting, don't select those areas where these shear waves are distorted. Okay, these areas should not be, this particular area is distorted, so this area should not be selected while measuring. Okay, you should be selected where it is uniform. Okay, let us see another image. This is where single data is, single point is selected. Here multiple points, one point, second point, third point. See the shear wave data, the areas are selected in where the shear waves are more uniform or parallel. This is the distorted area. This distorted area should not be selected. Okay, it is more accurate in that way. In point shear wave, you do not have this control. You have to select particular area depending on your instinct. Okay, sometimes you may do it exactly at the middle like that, but here it is more accurate. You can select those areas which have good data. Here you can see, this is one point is selected. This is the shear wave data also. So this is basically the 2D shear wave elastography. This is the most advanced one. Nowadays there is another one, that is supersonic. So what it does actually, suppose in case of 2D SWE, one wave is, it is measuring one wave, suppose. Now, so what will supersonic do? It will again measure in fragments. Okay, if the 2D is measuring in single one wave, complete wave, it will, supersonic will variation, it will split this wave into multiple segments. That means more accurate data. Okay, but not so much of research has been done in humans also. Veterinary, no article, I didn't found any article in I have access to Google Scholar. Actually I don't have much access to, there are some premium websites where articles are published, but from Google Scholar I didn't found any article regarding the supersonic elastography, but it is existing. Okay, but I did found research has been done in case of dogs mostly, in some cats also, but the organs which has been has some research on elastography is liver, spleen, kidney. In kidney my guide has done some research, prostate, head and leg lymph nodes, skin nodules, mammary neoplasia. This is the most extensively researched, because this elastography can detect malignancy. Can detect malignancy with more than 90% accuracy. Okay, so it has some potential. Elastography has some potential in diagnosing the malignancy. You know that the histopathology, if you will send some samples, it may take months, and each day is very crucial in a cancer patient's life. So if you have some diagnostics can predict the malignancy, then on the basis of that result, you see, this is not a gold standard. Gold standard is always histopathology. It is not to replace histopathology, but it has some potential. It can diagnose malignancy, so that you can design a protocol which will be most suitable for that canine or feline patient who is having some cancer lesions. Okay, so that the pain can be alleviated, the cancer can be alleviated. Okay, so this particular thing is, you will find numerous articles on mammary neoplasia, because most study is based on the whether the elastography can detect the malignancy. Okay, but it has some promising result. I have also done, though I covered the mammary as well as skin, it has some accuracy regarding the predicting the lesion, especially the malignancy of the neoplasms. Okay, if you want to do research, you can definitely do. Testis, these organs are also having some elastography research. Patellar tendons, I found this article very fascinating. They have used elastography for patellar tendons for measuring the stifle joint mobility, depending on the elasticity value of the patellar tendons. Okay, so these are the basically research which has been done in elastography, and these particular organs has been the research has been done in these particular organs. If you are interested in any other organ, you can use. There are some very few articles where the intestines are also intestines, elastography of intestines has been done. You can check them out and you can do your research. This is a potentially good topic for research, because it is not that explored as compared to the medical science. Okay, and these are the basically the articles. You can take a screenshot. Okay, so these are the articles which I referred preparing this note, and the note is available in the description as well as this PPT, so you don't need to worry. Okay, so I hope this lecture was helpful. This was mostly for those who want to know something different. Okay, there is conventional USG obviously, but this is another thing. Okay, it is a topic of interest, or you can say it's a topic of research also. Okay, so this is all about elastography. Okay, next I think I'll go for the common or the techniques of abdominal scanning. Okay, so till then, tata, bye bye, take care.